auditory neuropathy, what is we have explained, actually I have discussed with Alina. Number one, the history is very important. Then you can suspect that you may go to auditory neuropathy. Because if you see in our experience, we have mostly done, we have covered 4,000 child of newborn hearing screening. And if you see the high risk factor from the NICU, then one is called the hyperbilirubinemia. The issue is how hyperbilirubinemia causes hearing loss in the children. What is the target? What is the etiopathalness? One is how bilirubin causes hearing loss. Then the whole thing will come actually. That's how bilirubin causes hearing loss. How?
It causes damage of this hair cells basically.
Which hair cells?
Inner hair.
And so OE pick up outer hair cells. So you will get OE. OE is pus. So this is the one classical. You are right. It causes damage in the inner hair cells. Plus also auditory nerve. This is the most important thing. That's why neuropathy. From inner hair cells to the nerve. So that's why we're telling very common sense. The neuropathy. Then there should be a nerve. Basic idea, very simple way. There should be a nerve. This is the 8th nerve. So that's why you see why is history important. Why you should measure clinically. If suppose child is 4 months, universal hearing screening, OE may be passed because, and also Bera maybe he will get a normal cup because he is in the process. Are you getting? So that's why clinically what is important. It's not that Sari Mahate Ami Deta Basa OE pass Bera normal. But if you have a, that's why I asked them to take the history of bilirubin. What is the level of bilirubin? I know already they have a data now. They are doing a good data collection. Say what is the level of bilirubin? Number 1. And for that highest bilirubin for how many hours? That's number 2. And what is the intervention they are doing? The pediatrician. If the history of exchange transfusion is there, so we have to correlate our data with the exchange transfusion this much of hearing loss. So these are the very important. That's why he can adi sign mahot normal way bera second top so he can follow up if their child has a speech delay. Then you have to repeat again hearing this. You see that day OE may be again pass. Bera you will not get a good no synchrony by you have to finding bias. But again see one day will come. Akol tak follow up then they may OE may be also fail. Bera may be no response. So that's why what is take home message in hyperbilirubinemia cases we need a long-term follow-up of these children after school age. This is the as a whole pediatric ENT bohan meeting on. This is the most important thing. Don't declare the patient. Pratiksha Academic bera korichilu like one holo Bohaniman like the Bohaniman case. Now we have Zinda cases. Bohaniman is not
like example.
What Vishwajit is actually saying is the extreme end of the difficulty level. Because in a child who has not yet learned to speak and who cannot express himself, in that child it is the most difficult. But when we started learning about auditory neuropathy, probably 10, 12 years ago, I remember initially we had a couple of cases and we thought it would be malingering. 18-year-old girl coming with a history of I cannot go to college because I cannot understand anything in the school. But she is talking to you. In the chamber she is talking to you normally. PTA comes out normal. Everything else is normal. But Vera is not. Because at that time we were not aware of So learns who is able to speak and to be an adult. They will say that in a quiet environment, they have to understand. But once they are in a noisy situation, they are in a bazaar or something, they won't.
Another very good points for history taking.
Those children initially we actually thought they were very good. And only later we see some kind of about 10, 12 years now. 1 year. 10, 12 years now.
Matric pass ko level ko, but they have a less performer. And also the very important here, they have not defined findings also. We are always looking for either normal bera or as he has mentioned, the degree of hearing loss. So degree of hearing loss is very important because of there may be mild to moderate loss cases are also there. Who are like from in school or big language lack of right. So that's we should get that thing also from the degree of hearing loss is should give more emphasis actually. Severe loss is I
have a question for the audience. Suppose when you do a Vera and you mark it as 1, 2, 3, 4, 5, most of the time the ENT doctor who is not too much into Vera will just look at, okay, these are the things. But often it has been seen, you have seen it yourself, that somebody has marked it but it has wrongly marked it. So how do we know which is the artifact and which is not? Because supposing somebody has done it somewhere not in Pratiksha and come with a graph and he has marked it normal Vera 1, 2, 3, 1, 2, 3, 4, 5 finished.
So two things that we look into while marking a peak. The first is the amplitude and second is the latency. Latency to the amplitude of the peak. When we see beras where the machine has marked the peaks, you'll see all the 7 peaks marked. Generally we look for 1, 3 and 5. That is like most important for a clinical diagnosis. So when you see those peaks are, they are they're clear and they are replicable. Those are the peaks. And artifacts will be, it will be very haphazard.
So actually, again, artifacts, there are different kinds of artifacts. So generally what we see in those automated areas are the ones which are stimulus artifacts. So they are very homogeneous. We see a replicating up and down curve. That is very easy to identify that it cannot be a auditory nerve response. But certain artifacts, like there is a general, probably a surrounding noise or internal noise, any body movement, any muscular artifact which is interfering. In those cases, sometimes even the auditory nerve response can get coupled with those artifacts and mask them, or sometimes the muscle artifacts may end up. Very commonly, the stiffness, a neck stiffening in the neck region that results in a very large peak in the same region, in that 5th peak region, and that sometimes does confuse people. It looks like the 5th peak also very large. So there we have to look, one thing, we have to look at the general way altogether, the overall morphology. If we see a sudden large peak, that we should always be a little wary about. When we are looking for wave 5, it's the negative slope that we are looking for. It's not just the peak that we are looking for, the negative slope. We should be more focused on the negative slope, and we should be focused on the replicating or not. So the relative amplitude of the peaks, they should be in coordination. It should not be the rest of the peaks are very small and then suddenly we're getting a huge artifact, huge peak or trough. That is an artifact. And then secondly, when we are looking, especially most of us are focused on the 5th peak because that is the most robust one. So there we should be looking at the negative slope. And again, I would not say that there are many recordings, Vera recordings, if the parameters are not set well. There are many Vera recordings, even when the responses are there, it may look very noisy. So we should not always discard saying that this is a noisy response.
But then what are the things that you do to prevent artifacts?
First and foremost thing is the environment. We should make sure that we do not have unnecessary electrical, and unnecessary sending of electromagnetic energy. So we should not be switching on unnecessary equipments like the things. Try to keep them switched off at that point of time. Mobile phones are used to cause artifacts. Try to avoid carrying them into the room, or even if they are there, we try to keep them switched off. The grounding, when the Vera room is created, the grounding itself is very important.
Because here from initial day we are concerned on grounding. That's why till that day we know. But that old building, my sense my only duty was to sit in and it is all not. I have this is not the Kwan actually. They have lots of like Excel proper grounding kind of good. It's made, but they people always put them only. বহুত কিবা কিবি মিছ কৰিব লাগে আৰু বহুত কিবা কিবি প্লেট ৰাখিব লাগে সেইকাৰণে they have lots of problem in it. But here from initial day আৰু there should not be any UPS line.
Yes.
Central UPS. This is the most important. What I have this is মানে central UPS line কেতিয়াও থাকিব নালাগে সেইকাৰণে in Bera room I have no UPS line. This is a very important thing to
these are two things which create a lot of problems. Once these artifacts are there, we can't record anything. Then the status of the patient, of course, relaxed and not moving and all of that. A child needs to be asleep. For an adult, we need to make them relaxed. For a lot of adults also, it's very difficult for them to stay relaxed, and at times that also becomes difficult. The cleaning, the scrubbing becomes very important. The scrubbing has to be proper, otherwise impedances will be high, conduction will be low. And apart from that, the filter that we are setting
should be checked once.
and
Many of the times I have
from the clinical importance is most important is what the test you will give for that. That's what they are saying. What the condition of the patients. Because if there is a miliary infection, if he has a secret order, if he has upper respiratory technique, it is duty of the clinician. They rule out the upper respiratory because rule out the miliary part. So what our team is do, they do always start the evidence. Actually, so how we should write? Let's write a hearing evaluation. Don't write a Bera. You give the freedom to the audio team. Write a hearing evaluation of the side. So that way they start the synchrony. Then they will first do the impedance. Then they will first what they have. This is for otoscopy because pediatrician may not do the otoscopy, but that time X may be there. So you will be referred. You will not get the X-ray curve. Second is the medullary infection. Medullary infection they generally confused, so they again so then they do the impedance. So if the impedance they found they decide the medullary pathology, like maybe not acute, maybe secret or media, he is an adenoid patient. So all these things our duty to rule out. Neither we have a fallacy that we have put another Beraton.
Sorry to interrupt. Tell me one thing. How much does medial or external pathology affect the Bera outcome?
it will affect the degree, the amount of hearing loss. I'm just
For
calling
way it's different.
yeah.
For Bera outcomes, how much does presence of wax or fluid in the medial?
It will reflect the amount of hearing loss that particular miliary pathology is causing.
But your stimulation, it should not affect, no? By
But it will, because the sound wave has to be conducted through the
no,
external.
but your
It will affect the latency.
It will affect the latency and the threshold level will be higher.
It's not affecting the Bera, it's affecting the stimulus.
Stimulus.
That is giving the Bera response.
Because they are going through your and
Bera is coming, Bera to stimulate to something good.
Amar kane kela important because now almost you are doing a epitome of practice. Ekane amar phala pura bhul jabo na lage jiman hole akra agote mane kunbata center kora belek kotha mane hekini bostu ami jano je hetu kionu koriba lage dudina duta absorb korok
Hey, ইয়াৰ পৰা 99% correct report গলে it's not possible.
but সপ্তাহ তই অখদি বিনি দিবি দুসপ্তাহ পিছত কৰক না সেইকাৰণে সিডেট টু
আৰু সেকেন্ড এটা প্ৰবলেম কি হয় কেতিয়াবা ধৰক অকমান দূৰৰ পেশেন্টবোৰ আজি ভ্যাকচিনো দিম আমি বেৰাখনো কৰাম হেনেকে আহে ন আৰু ধৰক এতিয়া 9-10 পেশেন্ট আছে সিহঁতৰ ফাৰ্ষ্ট কথাটো যে পটকে ভ্যাকচিনটো দিয়া পিছত বেৰাখন কৰিম বিকজ ইউ ডোন্ট আন্ডাৰষ্টেণ্ড এটা ভ্যাকচিনেশন মানে কি বাচ্চাটোৰ পেইন ইমান হয় তাৰপিছত পেডিক্লোৰ লেডিও হাফ ডোজেজত কোনো বাচ্চাই নুখুৱে আজিকালি স্যাৰ মানে কেতিয়াবা ফুল বটল গুচি যায়
মানে কথাটো কেলে স্যাৰ মই এতিয়া আৰু কথা কাৰণে কৈছে প্ৰতিদিনে এটা ডায়লগ লিখা আছে হয় ইটস আ টেষ্ট অফ ব্ৰেইন নট ইউৰ টেষ্ট অফ হিয়াৰিং actually he goes to the message should go man because we are not doing your hearing test we are testing your cognition we are testing your as a whole development actually he goes to the like amar practice mane amar group to practice nazano নহলে অকল সিম্পল বেলেগো আজিকালি আৰম্ভ হৈ গৈছে ওই অলৰেডি ইন গুৱাহাটী সবে কৰা আৰম্ভ হৈছে দ্যাটস এ গুড সাইন ওই কি আৰম্ভ হৈ গৈছে সো আমাৰ প্ৰেক্টিছত মই ভাবো কি we should হেতু লেভেলত যে we are মানে হেতু যদি হোৱা নাই বুজিছে না মনিছ কোনটো কথা কৈছে it's not a Bera it's not a way actually it's a overall আৰু হেতু এটা ডেভেলপমেন্ট প্ৰেক্টিস ডেভেলপমেন্ট ক্লিনিক্সৰ ৰুলটো মানে বহুত আছে এই কথাটো লং টাৰ্ম ফলো হ'লে
Caesar patient or Caesar
15 মানে লাস্ট এপিসোডত যোনটো প্ৰটোকল হয় ন হেতুৱে কৈছে লাস্ট যোনটো এপিসোডত সিজাৰ হ'ব হেতু এটলিষ্ট আমি 15 বা 20 ডেজ মান ৰখি দিব লাগে নেক্সট এটা বেৰা কৰিব লাগে
after discuss কৰিলে হ'ল after discuss কৰিলে হ'ল আৰু
লাস্ট ইনফাইট যোনবোৰ অকমান থাকে ন
meningitis বিলাকক কিমান দিন কৰিব লাগে meningitis কেছ এটা suppose
meningitis.
মানে কি আর as soon as possible, as soon as the overall they are stable enough and they are bring them to the department.
আমি জানি না শিশু like 10 days আগতে হৈছিল ন
Anti-epileptics don't make a difference on the Bera results.
anti-epileptics. I'm not very sure.
This won't make any difference.
No, I'm not very aware. Can you go to the protocol because I've got 3 to 4 children who got seizures. So the protocol says that you have to wait for at least 15 days. Then you can go for a bear.
Right.
Last episode
What
of
basically we want to know is there any medication which has to be avoided before doing a Bera? হেনুকাটো একো কথা নাই যে অমুক ঔষধটো খাই থাকিলে বেৰা কৰিব নোৱাৰে হেনুকা এটা একো suppose more for a vertigo patient if he is taking anti-vertigo drugs or a sedative or an antihistaminic and everything which causes a bit of sedation has to be stopped for 48 hours. For Bera, I don't think there is anything such.
Not much. Again, because in Bera we are looking more at the peripheral nerve, and these generally will have an effect on the muscles or on a more central level.
কি কলে এই থাকিলে কি কৰিব ক'লে এপিলেপসি থাকিলে কি কৰিব লাগে
15 days of last episode. Last episode.
This is going to need follow-up Bera.
Yes, sir. Then we need follow-up
How
Bera.
big can be?
At least till 2 years we have to keep on doing.
We have the
Every
patients
month, every 6 months.
for this one.
Every
I'm not
day.
sure
No,
if
no,
there's
no.
a fixed protocol. on
Till
that.
2 years, but
Till 2 years because they're coming
how
of
often?
age.
How often?
Maybe 3 months, 6 months.
No. এখানে আমি এক্সেল ফিগার তুমি কত পয়সা কিতাবত কিতাব পয়সা
সেইটোৱে কি মানে what is the protocol post meningitis কিমান দিনৰ মূৰত
সেইকাৰণে আমাৰ ক্ষেত্ৰত because বেৰা
post meningitis is very important
বেৰাটো বহুত ইম্পৰ্টেণ্ট কিন্তু আমাৰ কাৰণে মেনিঞ্জাইটিছ কেছ এটা ফলো আপ এমআৰআই
কিন্তু sir, MRI কিমান frequently কৰি থকা
এমআৰআই কোনো হয়
MRI is not there is no radiation it's basically
Except for the extension.
CT scan is the problem MRI can be done
পেশেন্টৰ দুনিয়াকে এমআৰআই সিডেশন ইস্যু ইজ অলৰেডি
So it's a basic question. I always wonder when I didn't see the result in any literature. Why in Bera the stimulation